The panel's discussions will be advocacy and action in local communities. And it's important to know that when we really want to do change, start in the local communities and start from the bottom to the top. And I want to quote Dolores Huertas. She's an activist leader that said that every moment is an opportunity to organize, that every person is a potential activist, and every minute we have a chance to change the world. And we're having today an extraordinary panel here of all Spartanburg advocates and leaders of the community. And I want to introduce first the moderator. His name is Marquise Clark. He's from the Cleveland Leadership Academy. Proud to say that he's a Cleveland fellow from my class. That I have to say now that he's Dr. Marquise Clark. He presents his PhD in these days, and also to congratulate him because he recently the Cleveland Academy of Leadership received an excellent award in the institution. So when we're talking about advocates and people for change, we have in here Dr. Marquise Clark. So the floor is yours. Before that, I would like to acknowledge also that we have in here Bree Maxwell and Carol Fowler. They are members of the DNC. Now the floor is yours.
Thank you so much. Grateful to be here this afternoon with you all. My name is Marquise Clark. That was says, as it was mentioned earlier, I'm the principal at the Cleveland Academy of Leadership. The Cleveland Academy of Leadership is situated just about a mile down the road here off of Howard Street at 151 Franklin. The Cleveland Academy of Leadership has long been an anchor in the city of Spartanburg. For 23 consecutive years, the Cleveland Academy of Leadership was once ranked among South Carolina's worst performing schools, but also the nation's worst performing school. But through collective impacts and continuous improvement and community support, we've been able to turn that school around to not only be among the best performing schools in the county, but also in the state. And so we're very proud of that work and grateful. What makes that significant is the Cleveland Academy of Leadership has a poverty index of 92.5%. We have a transiency index of 70%, meaning we only retain 30% of our students from kindergarten to fifth grade. On average, we lose about 40% year after year. But we have a truancy index of 84%. And so a school that is such an anomaly in terms of the struggles and the disadvantages of the community and children, we've still been able to equitably educate our students, so much so that Cleveland is ranked third in the state of all third grade students who took the math state assessment that have. So it can be done. And so the very core of the conversation we're going to have this afternoon is about investment for equitable opportunities, but also for equitable results. And so we're going to have each of our panelists introduce themselves. I'm going to start with my immediate left. So Dr. Harris, you start us off, please.
Yes, thank you very much, Dr. Clark. I've had the joy of seeing Dr. Clark and working with him a lot around Spartanburg and seeing the impact of his work. So I'm really pleased about the work that you do at Cleveland Academy. I'm Benny Harris, I'm the Chancellor of USC Upstate. I've been in the Upstate for 2.5 years. I come to the Upstate from Atlanta, Georgia, spent some time at Morehouse School of Medicine, and prior to that, spent time at a few other institutions. I grew up in the state of Mississippi on a farm, so I have a lot of appreciation for this conversation, for what education does for particularly communities of color, and particularly young African-American men who need to participate in a greater economic space. And so education is so important. And so I've dedicated my life and my career to education. My personal mission statement is to inspire and develop young people to change the world. And so education in the university setting has been that place where I say I can do the most work that aligns with who I am and what my passion is.
Good morning. My name is Mo Abu Saft. I am the District 1 representative on Spartanburg County Council. I'm the only Democrat on our 7-person county council. I am also a Clyburn Fellow of the class of 22, which is in partnership with class of 23, put the planning on to pull this event together. Thank y'all. Thank y'all for being here.
I'm Dr. Jamie Coakley Fowler. I am the Chief Medical Officer at Regenesis Healthcare here in Spartanburg. Regenesis, this is our 20th year that we're celebrating. So we're celebrating 20 years of service. I've been here for almost half of that. So I started in August of 2014 as the dentist and then the dental director. And then since July, I've been the Chief Medical Officer. And so our goal, of course, is to provide access, especially to our most vulnerable populations in Spartanburg, Cherokee, and Union counties.
Good afternoon. My name is Tootie Holmes. I am the owner and broker in charge of Tootie Holmes Realty here in Spartanburg, South Carolina. Grew up in the county, went to Burns, and was educated at the University of South Carolina undergrad, graduate school at Clemson. So I no, I did not start 2 masters. I just simply saw an opportunity at Clemson and took it. So started my career as a writer and journalist and wrote for many years. And then when I moved to Raleigh-Durham, Chapel Hill, got into real estate. And I've been in new home sales and construction and real estate for 20 years. I've been back here for 8 years, started the firm in 2016 and have been delighted with what I've seen in terms of community and the involvement, the care. It's been an honor to be a part of the festivities this week as well. So it's just another example I have seen here in this community. Very warm, very inviting, and I'm so happy to provide real estate services and a little bit more with Tootie Holmes Realty. Thank you.
Thank you. And just to set the record straight, there's only one master in South Carolina, and that's Clemson. Okay, so just want to make sure we get that understood.
Talk about that later.
So, Dr. Holmes, the first question is for you. Recent data has shown that South Carolina has a shortage of some 92,000 affordable housing units. And we know that Spartanburg is experiencing this issue as well. Can you talk about how the movement you've both seen to combat this issue and what your organization is doing about it?
So as far as the movement, there have been some pop-ups of mortgage lenders and some of them are nonprofits. And what they do is they kind of teach how first-time buyers can better purchase homes. There are programs where you don't need money down, no credit checks, don't need perfect credit, and they actually provide closing costs. And so I partnered with those. I did that when I was in Raleigh years ago, and it's a national program, and there are other offshoots that are similar, and some here locally. And so what they do essentially is have the homeowner go through classes and kind of learn how to be a homeowner and what the expectation is. A lot of homeowners, especially first-time buyers, don't realize they need to set aside some, like a percentage of the final sales price of the home just to be prepared for incidentals that will happen. They no longer can call the landlord or the property management company for anything that goes wrong in the home. It's now their responsibility. So that's one of the things of many that they teach. And so we partner with those particular organizations just to make sure that the home buyer can get into that home and be at ease. What my goal personally has always been is with first-time buyers is if they're paying a rent amount and they're used to paying that, I always talk about rhythms. So if they're in the rhythm of paying that, I like to have them have a smooth transition over to home ownership, having the same kind of payment in terms of their payment, monthly payment. And again, we just talked about incidentals and having that kind of budget for that. And so I think it's important with regards to this community in particular. When I moved here 8 years ago, in the city, there were no new construction projects going on at all in the city limits. There was a lot of the inventory was old. And so I found, especially with first-time buyers, they didn't have the opportunity not to just move into a turnkey product. They had to go in and do updates, and they didn't have the budget because they're first-time buyers. And so I've worked with the city, I've worked with the county, I've worked with, again, community partners, and again, those financial institutions to try to, again, improve our housing quality, the inventory, also allow them to have money set aside so that they can do any of the improvements. But it does, and in the 8 years I've been here, I've learned it is a collaborative effort. And so I would encourage homeowners to not go into it blindly, but you must create and have a team.
Mhm.
You know, you have a team if you need healthcare, you have a team if you need to do other things. Housing is no different. You can't necessarily go into it alone because there's so many rules and it changes daily in our profession. We have to go to update classes, learn what's happening in our industry. And so to go it without a real estate professional or attorney or appraisers or inspectors and other folks that are a part of that home buying journey, it's necessary. So that's one of the things that we at Tudor Homes Realty really talk about is that we want to make sure that homeowners understand you have to have that team component.
Excellent. Thank you.
Can I jump in on affordable housing for a second?
Yeah.
And I'm a sort of baby in this world, but so on Spartanburg County Council, we've set aside $2.5 million, and we have a couple other pools that we'll tap into that we think we can probably cobble together about $6 million to incentivize affordable housing. Now, what we haven't figured out is what does that look like? I think in this space, we have to remember affordable housing a lot of times gets a bad sort of name, and I think we as Democrats need to combat it. A lot of people think of like Section 8 housing and some, and I don't have any problem with those developments either. But when you talk about affordable, you're also talking about your teacher, your entry-level teacher, your entry-level police officer, your firefighter. I mean, the people, it's, government handouts, blah, blah, blah. But people think of those folks sort of as salt of the earth, but there's a lot of ways that their housing has to be subsidized. And those individuals oftentimes don't think of their housing being subsidized, but when the state has programs like the LIHTC program or county council sets aside money to bring developers in so that their ultimate costs are lower so that they can rent a unit at something below what they think the market would require, that's subsidized housing. And so it's a much bigger pool. The fact is, what I'm learning is that housing is a sort of difficult thing for humans. Like it is difficult to produce roofs over our heads just as across the spectrum into your money point. And it is not just the traditional face when we talk about affordable housing. It's a lot of other people, a lot of people who probably vote Republican and don't realize that we're over there making sure that they have a place in the community.
Great
Let me
point.
piggyback off of Mo's piggyback. And the other thing, when you use the word traditional, it was kind of a trigger. A lot of people think first-time buyers, they have to have a single-family home. And so one of the other things that I try to instill in some of the folks that come through our doors is that sometimes the first home may be an attached product. It could be a townhome or a condo. That doesn't mean it's your forever home. It just means it's an entry point. It allows you to get off that hamster wheel of paying high rents and rents going up and you having no control over that. And so a lot of the things that we talk about with regards to the policeman, my mom's a teacher and educator, and my first home was a townhome in Raleigh. And so I try to get people to kind of reimagine what that looks like. And then again, try to instill that, and set that expectation that your first home may not be what you've always thought it would be, but we can help you get there. And then we can start helping you to build. And then your next home in 3 to 5 years could be a single family home.
Excellent point. And I suppose it's a perfect segue to your second question, which is we've learned through recent data that 7.3% of all homeowners use that equity to start a small business in America. And so in many ways, the home ownership has been the pathway to the American dream. How do you ensure that once the home is obtained, it does not become the American nightmare to put families in an upside down home? So can you talk a little bit about how you ensure that as you support your clients, they get into property that actually has equity?
Yeah, so I always tell my clients, you don't want to be house poor. Again, especially with the first time buyers, I talk about I would say, what do you pay now? And they tell me, and I say, well, what would you like to pay, or what's your budget for your new home? And they tell me, and then I say, I'm not the money person. I have lender partners, but what I can tell you, when you sit down with the lender, and I'll be happy to sit with you, again, that team building. And I say to them, well, if they qualify you for $200,000 and your payments $2,000 a month, that doesn't necessarily mean we need to go shopping for $200,000, or that your payment should be all the way to $2,000 a month. You want to make sure that you qualify based on one person's salary if you have a two-parent or a two-person household, two adults in the household. Just because we've seen with the crash in 2008 and 2009 and some other things, and just with the economy, we know that there are influxes with regards to that. So you want to be prepared. And so being house poor is one of the things that I always talk about. I'm not interested in having my folks be qualified for something to the max and then go out and purchase into their max, because life happens, right?
Right.
And so that's one of the things that I've always said, and that's one of my philosophies, because you got to live. And I always tell people, and you see me in the community, so no need for you to be mad at me because you can't take that trip or do those things with your children,
Right,
because you are paying a payment that is well beyond what you can afford. So that's one way. And then to speak to how folks are taking equity out of their homes, that is one way a home is useful and has a usefulness, but obviously we all have a place to live. I always tell people, we all do, even some, homeless people have, they have to find shelter somewhere. And so what is it that's important to you? What is it that's necessary for you? How does that look? And again, setting that proper expectation. But I do believe that for, what you're saying with regards to that, making sure that people just have that team, talking to them about, making sure you get a 30-year fix. If you're expecting your income to increase, prepare for that. Just know that doesn't mean that you can spend to your max, but just be careful. And so I have a lot of, I'm known as a communicator, again, literature major. So I sometimes have been criticized of over communicating. But the point is to set the proper expectations so that the person that purchases will know exactly what they have in terms of avenues for their home. And again, if it's starting your business, that's one way you can use the equity out of your home. Paying for your children's education is another way to do that.
Mhm.
And so, but it shouldn't be used in that regard, except for situations like that. And usually financial institutions will ask, what is the reason for you taking money out of this home? So you have to be careful with that, but you also have to plan. And again, planning is one of those things in life, and housing is no different. Planning is necessary in housing.
excellent. Thank you for sharing. So, we just spoke about home ownership, but naturally we get access to home ownership through economic mobility, but also through having an education. So, Dr. Harris, Upstate has seen tremendous progress since you took leadership. In fact, I was joking with Dr. Harris just earlier this week. So, most times when leaders come into an institution, they take the first 2 years to sort of get the lay of the land and they're kind of quiet. Not Dr. Harris. He got in there and got to work right away. So Upstate is on track to help Spartanburg meet its 2030 goal for the 40% post-secondary degree attainment. You've invested in programming to support first-generation college students, create pipelines to nursing, STEM fields, and even invested in on-campus healthcare. Can you talk a little bit about, from your perspective, how Upstate's local investment has impacted some of those efforts?
Upstate the region or USC Upstate?
Upstate the region to
Okay.
support your campus.
Oh, definitely. I think one of the most amazing things that USC Upstate is already a jewel of the Upstate. And I believe I came to it and it was very understated. People say, well, you're the best kept secret. Don't let anyone allow you to be the best kept secret. I think that's problematic. USC Upstate, 1 out of every 5 nurse at Prisma Health or Spartanburg Regional Health System is a graduate of USC Upstate. 1 out of every 5 teachers in the Greenville County Schools District and the Spartanburg 7-County District is a USC Upstate graduate. When you look at some of the major corporations, whether it's Milligan, ACA, Johnson Development, all these corporations around here, you're going to find a high level of USC Upstate alumni being employed there. So unfortunately, I don't think that translates from a community perspective, the value that we are being the only regional comprehensive public university in the Upstate. And so part of my mandate and my passion is one, how do I elevate our presence in the community? How do I partner with those entities like the Spartanburg Academic Movement, like the Greenville Chamber, like One Spartanburg, to amplify the work that we do. So we're in the middle of a strategic plan right now. And so our strategic plan has pulled together several strategic plans across the upstate and ensuring that we align with where we're trying to go as a region and not just living in an isolated vacuum. Higher education in general has to continue to elevate its value. There's a major attack across the country on higher education, whether it's freedom of speech, whether it's DEI. People have a great appreciation for technical colleges. They understand research university, but they have very little understanding of those regional comprehensive university. And we educate about 60% of all students of color in this country. Institutions like USC Upstate, Winthrop, Lander, all of us are similar type of institutions, and we are delivering on the American promise. So when you look at Latinx population, when you look at the African American population, when you look at women and other diverse population, they are being educated primarily at institutions like USC Upstate. So I see it as an opportunity for us to invest in those students and in those communities. Many people would not realize that USC Upstate is right at 50% students of color.
HBCU.
And most people are still feeling now what's going to happen, what is actually happening at all of our institutions. When you look at the enrollment cliff, in 2 years, we're going to have a precipitous drop because in 2008, during the recession, people just weren't having babies. So you can't make up those numbers. Okay. So they're gone. Okay, so it's going to turn around, but we're going to have this precipitous drop. People who are still believing that education is the great equalizer are Latinx people and African American people. So you're going to see more and more Hispanics and Latinx students on our campuses, and we are not prepared to embrace them and to put them in this tapestry of equity and fairness. The same thing with Hispanic African American students. So white folks were not having any more babies, and they're not having a lot. Black folks have started leveling out on how many babies they're going to have. Hispanics are still having babies, and Latinx people are having babies. And those are the folks that's going to be in our higher education institution. So we have a major, major paradigm shift in higher education in general. And how that relates to the upstate, these are the same demographics that are taking place in the upstate. And I believe USC Upstate is poised to partner and to embrace that change and to make it much more productive. USC Upstate was ranked number 1 in the state of South Carolina last year in social mobility. Number 1.
Wow.
Okay. And what does that mean? It means, thank you.
Yes.
It means that students who come to us, them and their families have a better life as a result of coming to USC Upstate. We were number 1. We were number 7 in the Southeastern region. And that includes every university, not just comprehensive university, but students who come to us are being successful. And one final thought before I pause is that at USC Upstate, we have a 0 equity gap in graduation. What does that mean? Our African-American students, our Latinx students, our Asian students, our white students achieve at the same rate. Most institutions across the country, there's about a 10% gap in terms of Black achievement over white achievement. We have a 0 achievement gap. And that's very, very phenomenal. It suggests that students who come to USC Upstate achieve and graduate at the same rate as white students. And that's a proud thing that we're very proud of. It's a guarantee to families that if your kid come to us, we are committed to seeing him and her graduate.
Excellent. And indeed, that has always been the purpose of higher education, right? Social and economic mobility. Representative James Clyburn is quoted for saying that an education is the greatest equalizer in America. However, of course, as a public school educator, I believe that an equitable education is actually the greatest equalizer. So, Dr. Harris, you mentioned the 0 equity in your students' graduation. Can you talk about the strategies you put in place at USC Upstate to reduce that equity gap or eliminate it in this case?
Yeah. Interestingly, the strategies that I am committed to are the exact same strategies that got me into education. And that is mentorship, and ensuring that you believe that everybody that comes in front of you has an opportunity to achieve and can achieve. I grew up in a very rural town, not a very rural town. I actually grew up on a farm, so I don't know how rural you can get. There were only 10 of us, 8 kids and 2 parents, and we grew up on a cotton farm. My grandfather purchased land, and that land went on down to my father, and we lived off that land, etc. And it's at the cusp of integration had taken place, and so in Mississippi, most all the white students left and started academies. So when you go around the state of Mississippi, you're going to see Bayou Academy, Lee Academy, all these preps, and public schools were left. And so most of our legislators were white, so people were not investing in sending their kids to a private academy and sending their kid to a public school. So we had about 99% of our students at Rosedale High School were Black. But we had some white students, white faculty, teachers who chose to stay in the public school because they believed in education and they believed in equity and fairness. And one of those teachers was Mrs. Hemphill. She was my math teacher. Mrs. Hemphill would take 10 of us out who wanted to go to college, and she would teach us calculus because the school cannot afford to teach calculus. She would teach us physics. She taught us ACT prep, did all of those types of things. Why do I emphasize that particular factor? Because I suggest that every last one of us, regardless of our color or ethnicity, has a role in ensuring that everybody has an opportunity to education. And it was Mrs. Hemphill who encouraged me to go to Mississippi State instead of Jackson State. Nothing wrong with the HBCU. If I had gone to Jackson State, I was planning on being a doctor. If I'd gone to Mississippi State, I was going to be an engineer. And Mrs. Hemphill said to me, she said, Benny, I need you to go to Mississippi State because you need to show them how smart you are, that you're just as smart as anyone else. She said, too many people fought for you to have the ability to go there for you not to go there. Now, that made a big difference for me, okay? I went to Mississippi State, got an engineering degree, but my passion was to do the same thing that Mrs. Hemphill did for me with others. So that's how I led back into education. So education, when I graduated, I tell young folks to follow your passion. When you graduate, I chose not to practice engineering. A lot of my peers thought I was crazy. I took a job for $24,000 at Washington State University, when many of them were taking jobs for $55,000 and $60,000 in engineering. And in 1990, that's a lot of money, okay? So let's put it in context. I followed my passion because of all the mentoring that took place and that people gave me, important to me. And within less than 4 years, the economic gap had closed because I was doing what I loved and I had people that were supporting me. And I've continued on that particular trajectory. What does that have to do with equity? I don't believe that you can find a young man, myself, growing up on a farm. Neither parents were formally educated with a high school degree, but exceptionally brilliant, 8 children. All of us go to college except my oldest brother who passed away. All of us go to college and are having productive careers. It was education that created that level of equity and allowed me to participate economically, academically, politically, all of those types of things. And we have to do the same thing for young folks today as well.
Thank you. Absolutely. So, Councilman Abbystaff, this is for you. So, as a board member to Carolina Foothills Federal Credit Union, we've had the privilege and absolute luxury of working with Councilman Abbystaff in creating Power Up. So I pulled some numbers, took the liberty as a board member to pull some numbers. So right now, thanks to his work. So thanks to his work, we're at 28 loans that have been given to 95% minority business owners. Those 28 loans from July to last week has been $779,000 in what Power Up and Carolina Foothills Federal Credit Union have lent to minority business owners in Spartanburg County. So, Councilman, you were a big part in spearheading Power Up, a groundbreaking initiative supporting small and minority businesses. Can you talk a little bit about how you envision the local investment impacting our community?
Absolutely. So I'm extremely proud of Power Up, and if you're not going to toot your own horn, I'm in the wrong business. So
All politicians do. So.
Yeah, that's right. So you know, I dreamed up Power Up, and I never thought, really, I didn't think I was going to get it done, to be honest. So County Council in Spartanburg is 7 members, 6 of them Republicans. We got $62 million from the federal government. Whenever we're at council meetings, I call them Biden dollars, because I want people to remember. Because I want everybody else to remember, you know, the count, my fellow members who give all that anti-tax talk, but they're happy to be at the ribbon cuttings for the $62 million we've split to do infrastructure and all type of things. But out of those $62 million, I was able to get $6.2 million to go into small and minority business. We then took that $6.2 million and we went over to Carolina Foothills, and I knew they were the right partner. I had done business with them before. I knew they're the type of bankers that want to get to yes. And I'll explain more about that at another time. But there's some people who want to get to no, and some people who want to get to yes. And so we took 2.5 million of the 6 million and turned just that chunk into $10 million loan pool for small and minority business. And so what you just heard, if it went over your head, is that $700 million in less than 6 months, $700,000. Let me not get too big now. $700,000, 95% went into a small and minority business. Well, 95% of that is just into minority business. And so 10 million is where we'll end before we have to re-up anything. And we're already sort of working on what does the re-up look like. But it's important because you heard earlier that people of color were taking equity out of their home to start business. So capitalism requires capital. And we have been as a group, people of color, we have been designated to be the working class, right? Entrepreneurship is for other folk, right? We're the people that serve those entrepreneurs. And the way that's done is by not giving you access to capital. Just like some people pay off their home 10 times by renting. And you say, well, then why didn't they buy it? Because no one would give them the $3,000 to put down on the mortgage, right? It's not that they couldn't do it. It's a system that would never give them access to that very beginning. So why do so many people stay as workers? Well, it's a connected system. One of it's capital, the lack of it. Other things like healthcare, right? Because we get healthcare through our jobs. So it's hard for people that have diabetes or chronic stuff to then say, I'm going to take the entrepreneurial leap. And so I'm an owner of my own business, the law office of Mo Abu Saf, that I also have a construction related business. And so I've seen what it's done in my life. And so I was dreaming big about how it is that we could create a program that could take away that issue of capital, at least here in Spartanburg. And to the credit of my county council members, I got a lot of, kind of George Bush Republicans on county council, which that would have been a slur 20 years ago, but then we met the MAGA Republicans and you realize, so, and they said, Mo, we'll go with you. We'll go with you. I think they probably thought that there was going to be a more heavy emphasis on the small instead of the minority. But to their credit, they let me take 10% of everything that we got and start this program. And so we talked about the $750,000 of loans, about another $100,000 of grants have been issued, and another almost 150 or so of grants have been approved. So we're closing in on that $1 million milestone here in Spartanburg. And again, I'm proud to say that whether you're talking about the city, whether you're talking about the school district, whether you're talking about the state, that is the single biggest investment in minority wealth our county has ever seen. And so what does that mean for you guys? Because this isn't just an infomercial for Spartanburg. Man, dream big. When these funds come down, right, it doesn't matter if you got 7 Republicans and no Democrat, right? There are ways to pull your levers. Now, you got to be skilled, and you got to know on county council, I don't get everything I want, and I bite my tongue more than I ever wish I had to. But I was able to build the coalitions to get this done. And oftentimes this government money is the only way to create, to get over these kind of generational obstacles that have been put in our way. There's a lot of rich people in Atlanta. There's a lot of Black wealth, minority wealth in Atlanta. Guess where that came from? It came from somebody's willingness to allow people to have contracts from their airport, right? Their big public project. That's how they created that base. And so when these public projects come out, when these public dollars come out, dream and leverage the power of government, because the truth is that's the only way we're going to make up these gaps. Bootstrapping is a nice ideal, but it oftentimes is a part of the American myth.
So perfect segue. And I know you may be thinking, gosh, what can't the councilman do? He can't play golf, okay? But he has some friends who can really play. He beat me at Top Golf last year. But I also want to add that Carolina Foothills did do a rate buy down of an additional $19,000 through Power Up. But you were hitting on something with public contracts. So local media has just announced that some $700 million in development is happening in downtown Spartanburg. Can you talk about the importance of those subcontracts being equitable so that the prosperity we see in Spartanburg is balanced?
Yeah, absolutely. If you want to know something I haven't been able to do, it's this. Well, I haven't been able to do this two ways. One is I have not been able to get my county council to fully understand or allow me to create goals or sort of requirements for public dollar projects. We actually do we do good things on our county council, and then we don't talk about them because sometimes we've snuck them in and we don't want some of the wilder people to realize what we've already done. We do have a 5% bump up if you bid on one of our projects and you're a minority and you're using minority subcontractors, then you get a 5% bump up on your deal. Now I don't think most of our council people even know that that's true. So don't talk about it too much. Yeah, well, okay. Well, very good. Sorry, Bob. But we have not, it's not big enough. The fact is I have been telling people for a couple of years now that we need to band together and bring the contractor base to get into these large construction projects. And I'm not talking about a pipe dream. I know myself, I told you I had a construction business. When I was a public defender, there were some large projects being done. And they were swearing up and down, we don't have enough minority contracts. We just don't have them, Mo. We give contracts if we had them, but they don't exist. And so I started a construction final clean business and have been somewhat successful in being able to get into some of these public dollars. But even on our courthouse that's downtown, $700 million, $150 million courthouse, less than 1% are people of color that are involved with that project. And so we have to meet people halfway. The policymakers have to come halfway and create incentives for people of color to be on projects. But then communities of color have got to come halfway and put together the organizations that can take advantage of that. I wish, if anybody in here has a construction background or has some of those skills, if you bring a firm here that can do commercial work, I will support you and push to make you successful. We have to be a part of these larger public investments because to me, the issue for communities of color, and we don't touch on enough, is wealth. I don't know if it's because we spend so much time fighting against wealthy interests that then we don't talk about wealth. But it's fine to be Black and wealthy. It's fine to be brown and wealthy. It's fine to be a woman and be wealthy. And so we have got to talk about how we create wealth in our community so our community can have access to freedom.
May I add something to that as well? One of the things simultaneously when Commissioner Abusar was doing his work in county council, the Spartanburg, which is our local chamber, at the same time was doing studies to look and assess minority participation in the region. And we were probably about 10% lower than what's happened across the country in terms of minority
Wow.
participation. But in order to participate and the opportunities that have been created, we have to have the businesses to do it. At USC Upstate, we have our Start Me is something that we are partnered with in order to help work with local businesses, people who have business aspiration to help them start those types of things. Power Up as well is investing in minority businesses and getting mentors to help them to diversify and start businesses that they can have the capacity to participate. So part of what we want to do is a lot of our businesses are in hair care and, well, I don't need them, but well, I guess y'all all got hair. Some people less. And some of those other types of areas, but helping folks to diversify with construction business, with logistics business, those types of things as well, and helping African Americans and people of color participate in those types of businesses and giving the infrastructure to support that. So when you do have these opportunities, you have a list of qualified businesses that can participate. There's one thing to continue to complain about us not participating in construction projects and logistics projects and delivery projects, and we don't have the businesses to be able to put on the table when we open those types of doors for us to do that. So we have to continue to encourage folks to diversify their businesses.
Thanks for sharing. Absolutely. And so reviewing the order of the panel and the questions, it dawned on me, the order was not done purposefully, but it dawned on me that the congruency in sequence that we often prioritize health and healthcare in the African American community. And so, Dr. Coakley, it was the irony of this is we've spoken about education, housing, and entrepreneurship. And then the last part of this panel, we're going to talk about healthcare, which absolutely should probably be the primary focus in our community. And so, Dr. Coakley, one of Spartanburg's greatest gems is Regenesis. It has been a staple in our community for decades, working on solutions of health disparities and inequalities that face some of our most vulnerable populations. I certainly see that at the Cleveland Academy of Leadership. And Regenesis has become a model that others are utilizing in cities across this nation. Tell us a little bit about the approach of your organization and how you see local investments impacting the community.
So when it comes to Regenesis, the big goal and mission for us is access. So we want to make sure that we have quality health care that is available and accessible to all of those in our communities. Again, specifically our most vulnerable populations. So as we look at social determinants of health, so education, what is housing, economic stability, what does the neighborhood and the environment and their community look like? How do all of those things play into the ability of people to access health, to follow through with the recommendations, and to achieve longevity, health, and positive outcomes? And so all of those things play a part. You know, if you have housing that's not quite affordable and you're trying to make sure dollars get to the end of the month, then what's going to come off the table? Probably that preventive healthcare visit. If you don't have headaches, if you don't have problems, and you can do what you need to do when you're not in pain, then that's going to be the last thing on the list when it comes to keeping a roof over your head and making sure there's food on the table and you can get back and forth to work, you know? So then when we look at education, a lot of the problem sometimes is health literacy, and that people are relying on old school wives' tales and myths and things like that that are part of our cultural backgrounds that are so ingrained that it's hard for us to listen to people say, you need to change and do something different so that you can get a different outcome. And so being able to have the educational background to understand what the science and the research looks like to say, well, no, this is not that somebody's looking down on me or judging me, but this is my race, my ethnicity puts me at a higher risk for this, but there are behavior changes that I can do to balance out that playing field. And so if we don't have access to those services, then how are we going to continue to do the other things? If we're in pain and we're not healthy and we've got tons of visits up for reactive care, then we can't get to work to make the money to afford the house payment and all of those other things. So it's all so delicately connected and tips fields one way or the other in so many ways. And so at Regenesis, our goal is how do we make that care accessible? In Spartanburg, in our surrounding communities and counties, we are in a health profession shortage area. And so the government gives them scores and they range from, 0 to 25. 25 is your areas that are the shortest as far as health professions go. And so Spartanburg, we're in the 18, 19, 20, 23 categories for medical, dental, behavioral health. And so what does that look like for health professionals? If we want to come to a community like Spartanburg, we can get loan repayment dollars for that. And so, but what does that mean? It means that our professionals who are graduating with more debt because maybe they didn't have the familial wealth to not have the student loans, they need a place to go. And so at Regenesis, we're trying to make that a goal and an attainable goal to say, come here, serve our populations who need it. So increase that access to that quality care that you've learned to provide. And there are other benefits to that, not just your mission and being able to live out ultimately, hopefully what you were called to do. Ultimately, that's the reason I came here. We all say we get into our fields and we choose our passions because we want to help people, but which people do we want to help? Right. I recently told somebody dentistry has become very much about cosmetics and, the latest, greatest. How can I have that Colgate smile? But we separate it from a dental infection can kill you. And so what does oral health look like and how is that different from cosmetic dentistry? And so making sure that people have access to that subsection of health is something that's been lost. And so balancing all of those factors out, again, is the goal. Looking at it, our most recent data shows us that there's about 5,500 residents for every one primary care professional. And so if there's already limited access, who do you think gets the first bite at those available professionals, right? It's not going to be the people that are struggling to make ends meet. It's not going to be the people that are on Medicaid and have Medicare or are uninsured because they don't have a job that has health benefits, right? And so that the population of available professionals gets eaten up by the more well-off people who don't have those negative social determinants of health. And so how do we balance out that playing field? So we have, in addition to having professionals to provide the services, we do a sliding fee discount. So our patients who fall at or below 200% of the federal poverty guidelines are going to get a discount on services. And so what does that look like? That a family of three that makes $49,000 a year is the 200% federal poverty guideline cutoff. It's one working parent making $24 an hour. That's a lot of people. We talk about not just, our fast food workers and our retail workers, but that's our teachers. That's our frontline first responders. You have a father that's working and a stay-at-home mom because there's 2 or 3 kids, and they're automatically in that category. And so, what does that really look like, and where does that access fall, and how accessible is it? 5.5% of Spartanburg residents or households do not have a vehicle for transportation. That number goes up to 13% when you look at Black households. So even if you have Medicaid and Medicare, you have a place like Regenesis that has the services that are available to you, but you can't get there.
Mhm.
What does that look like? So we also have a transportation department. And so we will pick you up and take you to your visit. And we will take you to a pharmacy, not even our pharmacy. We have those, but we will take you to the pharmacy to pick your medications on the way back home. I like to say we're not going to stop you by the drugstore, the convenience store for all those other things, but we will get you your medicines and get you back home. Because what's the good of going to the visit, getting the diagnosis, but you can't manage the medications necessary for the daily management of your disease and your condition?
Yeah.
What does it look like if your recommendations are diet and exercise, and you live in an area that doesn't have a safe walking trail for you to get out and walk, or you don't have access to healthy food? What does that really look like in terms of health and outcomes? And how does that help you break all those other cycles?
Wow, well, thank you for sharing. You know, growing up rural and poor in South Carolina, Clarendon County, I can tell you that for as long as I can remember, up until recent years, the Goody powder and Robitussin was all that my daddy knew. So there was no such thing as a dentist. Get a Goody powder and keep going. But also, of course, she did a wonderful job really highlighting the programming of Regenesis. One of the things we learned at the Cleveland Academy of Leadership was our transition index was really impacting our student achievement. And so I went to a few key community partners 2 years ago, one being Carolina Foothills and the other being Regenesis Healthcare System. And what we sought to do was to offer housing for our families at Cleveland. And so we were able to build 3 homes for Cleveland families who did not have to have any interest rate. So the homes are built for our families at 0% interest at cost to build. And these homes went to all single working mothers at the Cleveland Academy of Leadership to not only give them a pathway to economic mobility, but to also help us with our transiency index. And when I called Regenesis, they were right on it. They did not hesitate to be a critical partner in supporting our families. And so, Dr. Coakley, you have a first row seat of what's happening in terms of mental health crisis in our country. The Cleveland Academy of Leadership is the second smallest school in Spartanburg School District 7. However, we have more than a third of all trauma cases as it relates to students having mental health crises, them either saying they want to hurt themselves or harm someone else, resulting in a mental health emergency. And so, Dr. Coakley, post-COVID-19, the rise of the mental health crisis has become abundantly clear. Can you talk a little bit about how Regenesis is communicating and supporting the importance of mental health priority, particularly in a community that has long regarded that as quite the social taboo?
So, mental health, obviously, again, like you said, for all those reasons, myths, backgrounds, culture, we don't like to talk about mental health. We don't like to talk about that we are sad and depressed and we don't want to get out of bed in the morning. We don't like to talk about that all of the uncertainties of finances and jobs and careers and children and families create anxieties. We don't like to talk about those things, but they're so important because we know that when we build them and we hold them in, there's always a boiling point. There's always that tipping point. And so what does that look like? So over the last few years, our behavioral health program has exploded. About 5 or 6 years ago, I think we had a full-time behavioral health counselor and maybe 2 part-timers. We now have a full-time behavioral health counselor in all of our fixed sites, all 7 of them. We also have behavioral health counselors in 30 schools in Spartanburg, Cherokee, and Union counties. And so with that, really kind of trying to shift that focus and change that dynamic around what does behavioral health, mental health look like? We also have 3 psychiatric nurse practitioners that are addressing mild to moderate psychiatric disorders and what that looks like and what that management looks like, whether that's talk therapy, medication therapy, et cetera. And those numbers, we found that for our communities, there are 256,000 residents for every 1 mental health professional. It's almost non-existent, right? So what does that really look like as far as where those needs are? And so, of course, as we talk about schools and having those behavioral health counselors in schools, most of those kids are talking about things that are happening at home and what they don't have control over and what they're experiencing and those traumas that are related to that. And so how do we have those conversations early so that we learn and develop coping mechanisms so that we can not use it as a stumbling block, but to use it as a stepping stone?
Wow. Thanks for sharing. Certainly piercing and gut-wrenching statistics around access to healthcare for our community. So I hope it's not lost upon us in terms of the intentionality of developing this panel. And so you have K-12 represented, you have post-secondary education represented, you have housing, health, the Renaissance man himself, who's in legal politics, but also community activism towards entrepreneurship. And so these are all the things that our community will need in terms of a democracy for all. This is how we gain access not only to the ballot, but also to economic and social mobility for all people, not only in Spartanburg, but also South Carolina and those representing the National Party across the great land of America. And so at this point, we'll entertain any questions from the audience. I believe we have someone here with a microphone, so feel free to ask any questions of the panel.
I don't have a question, but just a statement or just a topic to bring to the attention of everyone in this room. And Dr. Copley, I work for Community Medicine Foundation, which we do business as North Central Family Medicine in Rock Hill. I am the outreach director for our organization. So we go out and do a lot of outreach in the community. And we also have community health workers who assist our patients with the needs outside of healthcare. And a lot of what you spoke of is what we do at our organization as well. But I just want to put on the emphasis, if any legislators are in the room, think about community health workers being the future for healthcare and helping our patients, and not only our patients, but helping the patients of our community to better themselves. We are such a valuable resource to our organizations because we help our patients with all of the socioeconomical needs that they have, social health determinants, all of those things. We are the connector and the resources for our community to help them become entrepreneurs, to help them become homeowners, to help them to look at higher education. But we have no funding source except for the organization that employs us. And so we're looking to push. I am on the South Carolina Community Healthcare Worker Association board for the state of South Carolina. And we're looking to push legislators to start looking to pay us for the services that we provide. We're not social workers, but we're people of the community who know about our community and know what our community needs. And we know the resources in the community to connect our people with to make their lives better. So with that being said, and I'm going to sum it up again, if you are a legislator, know someone, talk about community health care workers for the state of South Carolina. We are the new wave, and we are the new move to help our community become better, to live healthier lifestyles. We work hand in hand with our patients in the community and connect. And and you say you do it because you love it. We do it because we see the benefit of helping someone move from a position of good to greater to better and best. And so just to be able to see the changes in our patient lives is amazing. The previous panel talked about stories. I'm going to give you a story. One of my community health workers in Chester, South Carolina, she was able to talk and encourage 2 patients to commit themselves to rehab to better themselves. So those are the impact that community health workers have in the lives of the patient in the community that we serve. So if you have time, go look us up. We got a website, South Carolina Community Health Workers.org, and start talking our speaking our language and supporting us.
Good afternoon. Peace and blessings be to all. Councilman, could you collaborate on the TIF money that being used with the TIF money for the communities? You're not
Sorry, my bad. I
Yeah.
can hear you.
10% of the 62 million.
instead of, yeah. I speak Gala. I'm from Charleston. Yeah.
The 10th, so the 6.2 that you were able to get.
Oh, just power up.
Yes.
Yeah, okay.
Yes.
I'm sorry, and what's the specific question? You wanted to hear more?
Elaborate.
I'm just a layperson that's trying to find some information, but I'm aware of
Yeah.
tip, the tip money that is being used for the businesses that's in the community.
Okay.
Yeah.
Yes, ma'am. I mean, I can provide you, I'm happy to provide you more information offline. So we have a director of Power Up, which is housed at our Community One Spartanburg. And there's a simplified application that moves through. We do businesses, I mean, we tried to take every hurdle that we saw in the EIDL and the PPP, and tried to get rid of them. So even if you have an idea business, so even if you haven't, there's a pool of money that and requirements that go for people that have an idea. If you got I mean, if you got an idea today from this conference and it makes business sense, Power Up, and you're in Spartanburg County, of course, the Spartan Power Up has $50,000 loans. That's sort of the beginning threshold. Sometimes there's been more, but it takes a special case to be made. And then and there's another pool of money for businesses that have been around for 3 years or more. Yes, ma'am.
Next question.
Good afternoon. Thank you all for everything that you've presented us with today. My question is, all of these programs that you've mentioned, from the real estate programs with mortgage lenders to the small business programs, are fantastic. But what is being done to provide the information to the general public? What channels, what platforms are being used? Because there's a saying that you don't know what you don't know. So if there's a program out there for a small business owner, how are they supposed to gain access to the information that it's available? How are they supposed to gain access to the information that there's a housing program that's available, that you don't have to have a great credit score or down payment? That's basically my general question, is what is being done to provide the information to the average everyday person that there's things available to them?
So I can share some of that. So the genius of Carolina Foothills and being a board member there is we are an CDIF, meaning that our charter is for the people. And so through Cleveland Academy with a poverty index of 93%, I frequently welcome Carolina Foothills to our PTO meetings, to our school events, our community events, to get the word out. But of course, using social media, we also do telephone blasts, robocalls, billboards, a plethora of advertisement opportunities, not only through the school, but also using those multimedia platforms to try to get to the masses as quickly and as readily as possible. Mhm. So I can tell you, Carolina Foothills, we're at pretty much every community event. So if it's an international fair, if it's downtown Spartanburg, there's a tent that you're going to see purple, orange, and gray to speak about all the opportunities for equity through the credit union. Yeah.
And as far as housing, before COVID, I had one of those national programs for the no credit, where you don't need perfect credit, no closing costs, no money for down payment. And they came here, and I think I had them at it's not Carver, Mary H. Wright, I think is where or maybe it was Carver in the gym. And so that was prior to COVID. But I do also use social media channels as well. But I think for me in this community, a lot of people have the kind of a preconceived notion of what a real estate agent looks like and what that involves. And so what I try to do is what I'm doing today is coming out and going out into the community. I've done fairs, I do workshops, I've done things with the Urban League personally, but I'm not saying that other real estate agents don't as well. That's just one of my advocacy items. But come see me, and that's how it starts. And so, but don't be afraid. I know a lot of people are afraid of healthcare and what they may learn, and they are afraid of housing, what they may feel like they can't qualify. We have to kind of overcome our fears. I mean, you have to stretch those muscles, you have to grow, and you have to take a chance. You can come and sit down in a meeting with me and it may not work. And that's not the end of the world. It just may be next year or a year and a half from now. A lot of people are afraid of what they don't know until they sit down with someone who does it every day, and we can break it down for you in a way that makes it attainable and realized more easily than you thought. So we're there, the resources are there. Yes, sometimes you do have to seek them out, and that's, that's the human part of it. I think that's any community. But I think also for people like us, and I know the people on this panel, most of the folks on this panel, and I now know Dr. Coakley, and again, our advocacy and our love for the community to try to get out the messaging is there. You just have to, dial in.
Okay. Hi, I sit on the board for Emerge Family Therapy and Training Clinic here in Spartanburg. And the first question is for the chancellor. We primarily work with Converse University because they're the only marriage and family therapy certification in the state. At any point, would USC Upstate considering offering that certification also to their psychology majors? And hold on, what about my next question? And for Mo, I also sit on a behavioral task force for addiction and substance abuse in Spartanburg with primarily focused with Favor and United Way. The $360 million that South Carolina received in the opioid settlement, how much money did Spartanburg receive, and how might we access that for nonprofits?
The answer is yes. That's very USC Upstate would love to look at credentialing and other type of certifications for our students, that they looking at a curriculum that allow them to take extra courses and have a certification in marriage and family as well. So the answer is yes. Just reach out to me and I'll connect you with who needs to be connected with.
Yes. As far as Spartanburg County, so the state was litigants and then subdivisions were litigants. So I don't know that we received, to the best of my knowledge, we haven't received our settlement yet. And the state's money would be just the state's money. So, but check with me in the next 6 months or so.
Great question. Any more? One more question.
I know that affordable housing can be a really tough nut to crack and lots of strategies and things like that. And I was just curious I don't know, what is the status of accessory dwelling units in Spartanburg County? Are they allowed by right? Is it only a special variance? And how is that on the radar at all for adding return on investment to housing, being able to potentially house people age in place in their neighborhoods closer to healthcare and all those sorts of things? Is that in the conversation in Spartanburg County?
It is. Yes, it is. I mean,
Oh, she got it.
Are accessory dwelling units allowed in Spartanburg County by right?
it's here as far as the by right. I could not speak to that in particular, but it sounds like you may have heard this from another community that is.
Oh, it's being used all over the country as a way to add density or easily and quickly, and in a decentralized way to add housing stock, particularly at the affordable level, entry level, affordable rents, and also return on investment for people who are stretched to purchase a single family home. That kind of thing. I was just wondering if it was part of the conversation here at all.
It has been in circles where I have navigated, and I can say Spartanburg Housing Authority is more. It sounds like that's kind of the answer to that question. But in that realm, yes, there are opportunities, and it does exist. But I know the city is also doing some things and talking to certain communities to address that particular concern. So there are conversations. A lot of folks, housing is very complex in the way that developments take time, and it's not, especially in a community like ours. Like I said, the housing stock is so old, and there's not a lot of development that has gone on in the city in the last 40 years. I think now, like when I got here 8 years ago, there was nothing new in the city limits with regard to housing in 40 years. So to get those things spearheaded, it still takes a lot of time. And you have to pull the right developers for the right project. And of course, the land itself and the availability of the land. You don't want to displace people that are already there. So there are a lot of components and moving parts, and all the stakeholders have to be in place to make it happen. And that can sometimes take months or years. So when you talk about it, it's not like the magic wand that we see in other communities. It's just simply that those are the conversations. But again, the resources are there. And again, Spartanburg Housing comes to mind, but there are other people that are engaged in, like I said, the city of Netherlands. I'm sure the county is involved, but there are opportunities for that and resources for that. Yes.
Thank you for sharing. Folks, let's give a round of applause to our wonderful.
And thank you all. And I want to thank these great leaders from Spartanburg and the upstate for spending time talking to us about this great work they're doing in our local communities. So give them another round of applause. Thank you. So you all are excused. We're going to have to do a set change shortly. So Phil, are you ready? All right. So a couple housekeeping items. Just need everybody to. So we have the way this is a preview to the town hall piece. We have index cards and pens, and we're going to pass them out. And if you don't have to do this right this second, but if you have a question that you want asked, this is the best way for us to facilitate getting as many questions through as humanly possible. We have 3 Clyburn fellows who will be asking questions today. So please write your question legibly. We'll collect the cards before we start the town hall. And if you have a question for Senator Booker, and you don't have to do it this second. If you think of one as it goes, write it on your card and we'll get it back. So you don't have to do this second, but we want to start getting these cards out and about. So, okay, after this next piece, we're going to take a 5-minute reset to get stage reset and for you all to use the restroom, but not just yet. So just stay right where you are. Stay right where you are. We're going to get these cards passed out. And I want to introduce the first vice chair for the South Carolina Democratic Party, Colleen Condon, who has a great announcement.
Thank you, Jay, and thanks everybody for being here. What a great day we've had here in Spartanburg. And of course, the best is yet to come with Senator Booker. So of course, y'all know more than the rest of the state, this Spratt Issues Conference is here to honor Congressman Spratt and his tremendous service to South Carolina. Yay. Congressman Spratt did so much for us, and we appreciate the opportunity to honor him in this way. Of course, we had the first part in Charleston, now the second part here in the home of his district, of his old district. And indeed, we'll be doing a third part in Columbia, waiting to nail that date down until we know who the special guests are and whether they can be available. So more to come. And of course, lots going to be happening between now and the primary February 4th. So if you are thankful for the state Democratic Party today, are you already a Yellow Dog Democrat? Do you belong to our recurring donor program? Our vice chairs here have envelopes and we have the QR code up here. You can hold your phone up if you're QR code savvy and it'll bring you right to the Act Blue page. If you give us just $25 a month, between $1 and $25 a month, but either donate regularly or do a $120 contribution now, it means you're invited to the Yellow Dog Lounge. The Yellow Dog Lounge, of course, has happened at the convention. It also happens at other special times. So I would encourage you to look at supporting us on a regular occasion. Myra and Michelle both have envelopes if you prefer to write a check, or we can pull it up on our phone for you. But we would love to have you be part of making more great things happen because we know we have a lot of work ahead of us. So if anybody can help us out, you can raise your hand and Myra or Michelle will help you out. Well, thank you so much for being here today, everybody. Know that the QR code is right here. If anybody has any issues with it, please let us know. And in case you're feeling the need for a little bit of sugar or caffeine, there is some more coffee and donuts out there. You can grab them real quick while we're doing the set change. Okay. Thank you for being with us.